everyone, karong adlaw mag-discuss ko about family planning o unsaon paggamit ang family planning. So, ang family planning daw is the practice of controlling the number of spacing of children in a family according to the couple's needs and preference. It can improve the health and well-being of women, children, and families. There are various methods of family planning, each with their own benefit, risk, and effectiveness. So these methods can be broadly divided into two na ay natural o artificial methods. Ang natural methods including calendar methods, basal body temperature or BBT, cervical mucus tracking, and lactation amenorrhea. These methods involve tracking fertility and avoiding intercourse during fertile periods. Ang artificial methods are also known as hormonal and chemical methods, include oral contraceptives or the pills, patches, rings, implants, and intrauterine devices or IUD, cervical cups, condoms, vasectomies, and tubal ligation or ligate. These methods works by preventing ovulation, blocking sperm, or alternating the lining of the uterus to prevent implantation. So, family planning methods can help individuals and couples control their reproductive life, offering the advantage of planning pregnancies and managing fertility. The choices of method depends on a variety of factors, including health, frequency of sexual activity, number of sexual partners, desire to have children in the future. So, kinsa ang mga makagamit sa family planning method? Ang makagamit sa family methods can be used by anyone or who is sexually active and wishes to prevent or plan on pregnancy. This includes both men and women, regarding of their age, health status, or whether they have had children before. It is important to note that all methods are suitable for individuals. The choices of family planning method can be defined on various factors such as the individual's health, lifestyle, personal preference, and their reproductive goals. For example, some methods might not be suitable for those who certain health condition, while others might not be prepared by those who plan to have children in their future. Nakuha na ta, how to use the family planning method. So, ang pinakaunang method kay oral contraceptive pills. Second is natural family planning. Ang oral contraceptive pills kay nabilang mo sa artificial method. Tapos, ang oral ang pills kay like kaning mga gagamit na kadaling if active yung sex life, if mas prefer nimo ni imnon kay mas dalian bitaw ka, tapos kanang ipot kalimtanon kay kanang kuan gud siya nga method kanang taga-adlaw gud nimo. Tapos ang second is natural family planning. Kani nga method kay like mag-track ka sa imong menstrual cycle, calendar method. Tapos kani ding basal body temperature, kani may bala nimo ang tungod sa kainit kun sa imong lawas bitaw may bala ka nga go-ovulate na recover kana. Tapos kanang observe ka sa imong cervical mucus bitaw kanang murag kanang dili mo makasabot ang mga lalaki na nikay. Ang babae na mo ay naman gyud ta sa lalaki kanang may bala nila kung income bitaw fertile sa nas. Hindi ang babae murag iba na fertile may bala nimo mga lalaki bitaw. Kunya na ma-discuss naman nato. Ang second kay condoms. Kini kay ang condoms kini gyud kailangan kung mag-intercourse bitaw mo kailangan magamit kadani permi para kung gusto ko maka-prevent of pregnancy para po kuan ka ng makalikay sa sakit like STIs. Ang second one is IUDs. If mas prefer nimo ang IUD, Pero kanang mga kuan kanang daghan na ng anak bitaw ang magamit implants or injection kaning kan implants ni kaning gani bitaw ibutang ani ba tapos kana kung sa kanang inject tawag kalimot ko tawag tapos emergency contraceptive kanang gikan kanang intercourse tapos wala ka nagamit og condom wala ka nakainom sa imong pills wala imong paliton para ma-prevent og pregnancy. Tapos dito din sa advantage and disadvantage of using in family planning. Number 1 sa advantage of natural methods sa family planning kay kuan siya kanang wala kay magasto kay kuan man naraman sa lawas dito na yung mga kuan man wala kay paliton wala kay kanang wala lagi ka paliton kay fair naman sa malawas naman yung makita ang kuan mag-track ka sa imong period namin mucosal o kuan na katong basal body temperature o kuan tapos dili po maka-involve sa drugs or kanang medical procedure tapos ang disadvantage po sa natural method kay dili mo mali kaya ning matakdan ka sa STI or STD o kuan kanang dili po siya very effective sa makakuan din sa pagburos kay na may uban nga lagayo nun kay bunon bitaw kanina ang advantage of artificial contraception methods. Number 1 is female and male condoms offer protection against STDs and very easy to pursue. Tapos, condoms can be used alongside other birth control methods. Number 3 is contraceptive pills are quite effective in preventing pregnancies and do not interrupt sexual activities. Tapos, ganit kung IUDs are long-lasting and may reduce menstrual cramps and flow. Tapos number 5, male and female sterilization is highly effective. So disadvantage of the artificial is condoms may not be effective as other birth control methods. And the contraceptive pills must be taken daily and do not offer protection against STDs. Tapos pain is experienced when inserting and removing IUDs and it may slip out of place. Diba na ang mga intercourse mo? Male and female sterilization requires surgery, which is costly and cannot be reversed. Emergency contraceptive methods are those that can be used to prevent pregnancy within 5 days after sexual intercourse. This can be done through the use of copper-bearing intrauterine devices or IUDs and emergency contraceptive pills ECPs. They are capable of preventing 95% of pregnancies by WHO in 2021. Level of protection in using the family planning method. The effectiveness of family planning methods can be widely depending on the method used. Number 1 is barrier methods like condoms. These methods are about 85 to 98% effective with perfect use, but this can be dropped to around 80% with typically used due to factors like incorrect application of or forgetting to use them every time. Number 2 is hormonal methods like birth controls, patches, injection rings. These methods can be used 99% effective with perfect use, but this falls to around 91% with typical use. Tapos, ang nakatulo is intrauterine devices or IVs and implants. These are among the most effective family planning methods with effectiveness rates of over 99% for both and perfect and typical use. Number 3 is natural methods, fertility, awareness, or withdrawal. These methods are less reliable with effectiveness rates ranging from around 75 to 88%. With perfect use, and this can drop significantly with typical use. And number 5 is sterilization, like vasectomy or tubal ligation. These are permanent methods of contraception and are over 99% effective. Remember, guys, no method is 100% effective and most methods do not protect against sexual transmitted infection. Condoms are the only method that can protect against both pregnancy and STIs. So, family method should be utilized. The duration for which a person should use a family planning methods depends on their individual circumstance and reproductive goals. Number 1 is personal preference, the length of time a person chooses to use a family planning. Methods can be based on their personal preference and plans for starting or expanding their family. Some individuals may use family planning methods for years, while others may use them for longer periods. Second is contraceptive needs. The duration of family planning use may also depend on a person's contraceptive needs. For example, if someone is in a committed relationship and does not want to have children in the near future, they may choose to use a family planning method constantly until they are ready to conceive. Number 3 is method effectiveness. The effectiveness of choosing family planning methods can also influence the duration of use. Some methods like hormonal contraceptives or long-acting reversible contraceptives such as IUDs or implants can provide effective contraception for several years, while others like barrier methods require consistent and correct use each time. Number 4 is reproductive goals. If a person has completed their desired family size or has decided not to have children, they may choose to undergo permanent methods of contraception such as sterilization procedures. It is important to consult with a healthcare provider to discuss individuals' circumstance, preference, and any potential changes in reproductive goals. So, tuduan na mo sa pag gamit sa condom properly. So, first is check the expiration date. Ang expiration date sa galing ang condom is nasa ilalog. Nakita niyo siya dani, ang expiration date ani kay May 2028. Tapos, the second is open it properly using your fingers para, or di mo mag-use sa gunting or sa kung nga sharp object kay basin kuhanin niyo ang condom mabuslot. Third is pinch mo. Pinch the tip of the condom within your thumb. Pinch. See, like this. Pinch between your finger to ensure there is no air trapped inside. This space is important to collect semen during ejaculation. Tapos, place the condom over the erect penis. So lang tayo penis karon sa kuan nga botilya. Dani. Roll mo siya ka. If meron siyang i-kuan ang tip, i-pinch. Tapos, unroll the condom all over the way down the kuan sa penis until it's completely covered. Diyan, ano dyan? Dani. any air bubbles. If na yung air bubbles, hindi mo na siya pinanaon. Tapos during the sexual intercourse, make sure to keep the condom in place. It is important to use a new condom if you switch from anal to vaginal intercourse to prevent the spread of bacteria. After ejaculation, hold the condom to the base of the penis. Like this. This helps prevent the condom from slipping off the semen. Dispose the condom properly. Not, hindi mo siyang not. Ano tissue? Not yun siya. Para makakuha niya, prevent yung leakage dito sa semen. Tapos ang last is the cervical mucosal method in natural family planning. Ito rin condom kay kanang artificial ito mga method. Tapos, ang artificial ay ang natural na punta. Ang cervical mucosal method is a natural family planning method that involves observing changes in the cervical mucus throughout the menstrual cycle to determine fertility. It relies on the fact that the consistency and appearance of cervical mucus change in response to hormonal fluctuation during the menstrual cycle. First is begin by observing and recording the characteristic on your cervical mucus on a daily basis. You can do this by kanang ka sa toilet, like kumari siyang magkuha ka sa clean fingers ay mo vagina ay mo insert. Tanawin din mo if tapos pay attention into the consistency, color, and texture of your cervical mucus. At the beginning of your cycle after your period ends, you may notice little to no mucus. As you approach ovulation, the amount of your mucus it become more abundant, clear, slippery, and stretchy. Like in Dani, oh. Dani, okay. Dani, ang cervical mucus. Basta kung hindi niya ang imuhang cervical mucus kay nakasa imong ovulation stage. O, kasama ka na, fertile. After the mucus tends to become thicker, ang ovulation kay mas mukuan pagod siya. Mas mo sticky, tapos mo baga pagod. Tracking the changes in your cervical mucus over several cycles, you can identify patterns and determine your fertile and infertile days. The fertile window typically begins a few days before the appearance of fertile cervical mucus and ends a day or two after mucus change back to less fertile stage. It is important to avoid intercourse during the fertile period if you wish to prevent pregnancy. So that's all I want. Thank you.